Hey, what's up, everybody? Today, we're going to talk about how we can boost our immune systems naturally. I'm Risa Morimoto, your host, and you're watching Modern Aging, where we chat about innovative and holistic ways to elevate our health and well-being as we age. When you click on that little red button below that says subscribe on it with that little bell next to it, you'll be sure to be notified whenever a new episode is uploaded. I'd love for you to also check out our website at thisismodernaging.com for all our latest programs and events. Today, we're going to talk with Dr. Pamela Yee. She is a functional medicine doctor based up in Westchester, New York. She gave me a private tour of her organic garden, and you can check out that video up here. But for now, she's going to give us some tips on what we can do at home to ensure that we strengthen our immune system now that the cooler weather is upon us, which means more flu and more COVID-19. So check it out. I think this is a super important topic that everybody's really interested right now, just with the cooler weather coming up, to talk about how we can boost our immune system. But before we get to that, I wanted you to talk a little bit about yourself and how you became a functional medicine doctor and what functional medicine actually even is for those who may not even have heard of it.
Sure. So my training in medicine is as an internist. So, I went to medical school. I did my residency in internal medicine, but I always had a very strong calling towards more of the natural world. I think, the importance of food and nutrition. So I had a couple of opportunities in medical school to work with the University of Arizona Integrative Medicine Center. And so I started my track in medical school. And then after residency, I did a full-time fellowship in integrative medicine at Beth Israel in New York. And so that's where I started to really evolve my practice, to combine both internal medicine and other modalities, including functional medicine. And, I think of functional medicine as really just good medicine is what it is. I mean, it's really being able to have the time to get to know a patient, to really fully understand their problems, to listen. I mean, just having time alone is just precious. But it's also not just about treating the particular illness or symptom. It's really trying to delve deeply into finding perhaps what the root cause of that particular problem may be, and there may be many root causes. So it's a really complex dive into trying to really digest someone in their case and really come up with treatment plans that are not just pharmaceutical in nature. So they may be diet, they may be vitamins, they may be supplements, they may be acupuncture. It's a variety of different tools that we can use. So it's really a larger toolbox. And it's not like I don't use pharmaceuticals. There's a time and place, and there's a time and place for other natural things as well.
So is there a difference between functional medicine and integrative medicine, or are they pretty much synonymous?
They're little nuances. I think functional medicine has now taken a very specific course in terms of how it's taught. And there are specific protocols and sort of formulas that make up functional medicine, starting with diet, the gut, and how it has a complex interplay with other organ systems. And when I say integrative medicine, I think about other things like homeopathy and, Reiki and acupuncture, other herbalism. I mean, there's so many different nuances. And so I pretty much equate them to be the same, though.
That's awesome. So now that we're really upon the cooler season, which generally means more flu, and as everybody is suspecting, more COVID-19, why do you think, or do you think that it's better for us to start boosting our immune systems now before we're sick, while we're healthy, as opposed to kind of waiting until January, when we're deep into, when we start getting those sniffles or whatever it may be?
Yeah, well, the best time is all points of the year. But, in terms of a strong, well-functioning immune system, because a well-functioning immune system also means that it's like a surveillance system that also protects you from getting cancer. So I can make the argument for, yes, we should year-round be thinking about this. But yes, it's definitely on the minds of a lot of people. And I think that it's a question that people bring to me all the time. I see a lot of different complex cases ranging from autoimmune issues, neurological, but I see a lot of cancer patients, and a lot of cancer patients come to me and I ask them what their goals are. And a lot of them say, I want to boost my immune system. I want to improve my immune system. I think, which is a great thought. But I think a lot of people forget about how complicated that might be. So it's used in a very broad sense. But I think in terms of what we talk about today, it's just good. It's a good idea to just know what that really means. What does the immune system mean? And so I break it up into two things. There's two arms, the innate defense system, which is really non-specific. And you can think of this part of the immune system as sort of like the frontline soldier. They're there, they're ready at the border or barrier to engage with anything that shouldn't be there, right? And so these are certain cells in our bodies, natural killer cells, macrophages, and they also produce an inflammatory response. Like you actually want inflammation. Inflammation is something that also people say, I don't want inflammation. You need some inflammation. So that's one arm of the immune system.
Well, why would you say you need, what does inflammation tell us, that why would it be necessary? Because we are talking, like, it's so hyped up being like anti-inflammatory, you don't want inflammation. Why do you want inflammation?
Yeah, and that's why I want to clarify these terms because people use it so broadly. I mean, inflammation allows us to, it's a signal. So say you get cut. And so you have your part of your innate system compromised. So your body starts to recruit cells to the area, and it starts to ramp up what are called cytokines. And we'll talk about cytokines a little bit later as it relates to COVID. So you mount this inflammatory response so that there's signals to the rest of the immune system to come and fight any potential infections, for wound healing, etc. So it's a necessary response for our body. It's just that prolonged inflammation is a problem. The right amount at the right time is life-saving. So that's part of our innate defense system. And then there's the other arm, which is called the adaptive immune system. And you can think of it as more specific. It's like the special division forces like Navy SEALs or Delta Force. So they're going to go after very specific targets. And then they're going to keep this portfolio of that particular target so that they know when it returns, or if it returns, it knows how to fight it the next time. So I think that's kind of a nice, just broad overview of what the immune system means, because it is quite complex. And I think that, the question a lot of people have, given this upcoming cold and flu season and the pandemic, is, can I do something that's kind of quick and easy that can bolster the forces, both in the frontline soldiers and my Navy SEALs?
Exactly.
And yeah, and I'd like to talk about them, the things that I wanted to talk about, because there's just a plethora of natural immune boosting vitamins or herbs. But what I wanted to focus on were the things that probably were, I thought, most important given the COVID-19 pandemic. And I wanted to talk about a few things: vitamin D, zinc, elderberry, and mushrooms, medicinal mushrooms. But before I get into that, I think it's more important to talk about the foundation for which these supplements may sit upon. And I think in many ways that foundation is probably more important for immunity than those four things that I just mentioned. But they're not sexy, right? They're things like sleep, exercise, eating well, and stress management. But all of these things can actually impact immunity and inflammation states. So, when I have a patient who comes to me with a complicated issue, so it could be, a stage 4 lung cancer or a new autoimmune disorder, or they have about 10 different things that nobody can put together. So we usually sit at a table across from each other pre-COVID, and I have them look at the table. And I say, on this table, you are presenting to me this complex problem. And this table is held up by 4 legs. So each leg represents sleep, stress management, diet, and exercise. And I find out, what's weak about their legs. And some people have, 3 legs that are just barely holding on. And so they can imagine on this table the problem that they're giving me and how well we can work on it if we can get and reinforce those other legs. And if you do that, I tell them, if you do that, it's so much easier to work on this particular piece that you've come to me for. So I want to talk about how these things specifically impact immunity and inflammation. And so sleep is a big one. And, it's interesting, before the pandemic, I had so many people who were getting so little sleep from, the time they would wake up to commute, to go to work and come back. They were left with little choice to either, spend time with their family or get sleep. And so people were much more sleep deprived. And I'm finding more and more that because we don't have the commute as much for some people, we're working from home. That's actually been improving for some people, which is great. It's great news.
No, for me too. And for my husband too. It's funny that way. It is one of those silver lining.
Same here in this household. And so we know that sleep can actually dysregulate the immune system, and that T cells, natural killer cells, can actually be lowered in response to sleep deprivation. There are clear studies that have consistently shown that poor sleep is associated with this lowered immune function. And that, when I mentioned natural killer cells, by the way, that's actually an interesting cell that is both innate and adaptive, but it does what it says it does. It's a natural killer. So it actually seeks out things that are not supposed to be there and terminates them. You can kind of think of it that in that way.
Wow.
And, so there's this data that even a single night's poor sleep can reduce circulating natural killer cells by 70%. So that's just one night's poor sleep.
Are you kidding me? Wow.
No. And so it's I think when people are armed with this information, they're like, because people know, like, yes, I should get more sleep. But, when you hear this, it really impacts them to hear really the physiological changes that can happen. And, there's even 1 hour sleep can affect the body in such a way that with daylight savings time, for example, so in the spring, when we lose an hour of sleep to gain more light in the morning, what we see consistently is every year, that following Monday, there's a 24% increase in heart attacks.
What?
Every month after daylight savings time. So it's
wow.
I think it's something that, I wish we could advocate to get rid of, because that would be, a big impact to reduce heart attacks in that following Monday.
I mean, traveling across time zones I know that it impacts me quite a bit,
Yeah. And there's a whole issue of the circadian rhythm and disruption as well, especially in cancer. And so there's definitely this whole area of sleep medicine. I think that's incredibly important. But as it pertains to the immune system, it's very clear that it does impact immunity. And what it also does too, there was a very interesting study that they took people and they deprived them of sleep for a week before they would get a flu shot. And they found that these people didn't really get as good of a response when they were sleep deprived. I'm talking about like 4 to 6 hours of sleep. So they found that these people got 50% less antibody response than those who got 7 to 9 hours of sleep. So it's a very elegant study, because you see, you have a theory, you sleep deprive them, you actually measure a response of the adaptive immune response, and you see a 50% less robust response. So it's clear that, that mantra of "I'll sleep when I'm dead" it's really something that shouldn't be.
Right.
And I think the key point here in Pearl is really to aim for 7 to 8 hours of sleep.
So so those people who have sleep problems or sleep issues, if they're getting like 3 hours here, 4 hours here, that sort of thing, is that just as bad? Are you talking about like 7 to 8 hours consecutive?
Yes, ideally. Yeah. So some people have, they sleep deprived during the week and they try to make it up on the weekend. That
Right.
doesn't work.
Right. That doesn't count. Okay.
No.
Because every teenager does that. um,
Yeah, and well, the thing is, are they getting more sleep now since the pandemic?
right. Right.
Right.
So are there suggestions that you have for people to improve their sleep? Because I know a lot of people who just can't fall asleep. They just have so many sleep issues. So say they really want to, they just can't. Are there
Well,
herbal medicines? Are there certain things that you recommend that have
that,
helped?
that, that would that would be a topic in itself, right, for
Right.
us to discuss because there's so many etiologies. I mean, some women are menopausal or perimenopausal; they can't sleep, but I think the bulk of people who see me have issues with anxiety that keeps them from sleeping. So that sort of brings me to the next leg, and I think we can talk a little bit about managing stress, and how that also impacts sleep.
Mm-hmm.
So stress as being this second leg we talk about. We can get rid of stress, right? I mean, we all have situations where we can't just walk away from a job, a certain marital situation, or you know, um, a family member in poor health, right? So we have stress; it's part of life. It's the stress management that I'm talking about, right? So when you're stressed, physiologically, what happens? You have this increase of cortisol, which is a hormone that helps us manage stress. And and in small amounts, it's fine. It's necessary for us to get through hurdles. But when cortisol is prolonged, that's when it can impact our health. So you can think of it this way. I talk to patients a lot about having the foot on the gas pedal, right? And I have lots of patients who have the foot on the gas pedal and they don't take it off. And you probably know people like that, right? But it's a balance of the brake and the gas pedal. So foot on the gas pedal, high cortisol leads to there's a lot of data leading to certain types of illnesses. I can say that over the over 15 years I've been practicing, the amount of people that I see with a severe illness who are coming to see me, they talk about their lives right before that illness. And so many of them have had prolonged bouts of severe stress prior to that diagnosis. I mean, it's uncanny, what I've heard over the years. And
Can you give me an example? Is it like work stress type of thing? It's just,
yeah, it
is it?
could be. It could be just relentless. It could be poor sleep. It could be, I mean, usually the story I get is, somebody's family member had committed suicide and, their marriage was failing, or they're in a really heated divorce that was, taxing their whole family life. It could be any of these, prolonged bouts of severe stress that happen to all of us. And I think that that's the point. It happens to all of us, but how we manage it may be very different, and that's what I'm advocating. And by the way, with cortisol, when we're sleep deprived, our cortisol levels do go up. And when we can't sleep, it's usually because we're anxious about something, we're thinking about something. There's something that's stressful keeping us up. And we'll talk about managing that. But as in terms of cortisol affecting immunity, we know that cortisol does limit the host response to infection, and it affects both arms of the immune system, putting you at more risk for infections: fungal, bacteria, viral, parasitic. And so trying to control that foot on the gas pedal is going to be important in really helping your own immune system. And as we talk about these things, there's always that inflammation piece that comes in too. So we also know that excess cortisol over time, if you just put on the gas pedal, it's going to increase insulin in the body. You have this sort of this hyperinsulinemic state. And where the excess will also contribute to an inflammatory state. So excess cortisol, excess insulin, excess inflammation. So I think the key point in Pearl here, which also answers your first question about how do we manage sleep, is managing stress, right, in some way that you can fit in. And that may be a tall order for people, although during the pandemic, people had the rooms like, this is the time where I can actually work on the things that I've been, pushing under the carpet. And, they could be simple things like meditation, breathing exercise, a walk outside. And I think more importantly, for a lot of people, disconnecting from your phones or devices, maybe after dinner or completely on the weekend, and making this a very regular thing. So you just don't want to meditate 2 days of the week or once every other month, right? It's something that it's a practice that builds upon itself to have that type of effectiveness.
That's so true. I've been able to do that through the pandemic. I do all of those things, and I've never done them regularly beforehand because my schedule was always so crazy. But if you do create a habit within your life, it really does have this cumulative effect, I believe.
Yeah, and there are people who have, even with the pandemic, who have a crazy life now, right? They have to stay at home. They have 3 kids in the house. Maybe they have young ones as well, and it's impossible to get anything done. So some people are even more stressed now in the pandemic, and their answer to me is, well, I don't have time, right? And that's usually the thing about all of these legs is I don't have time. But, taking a short walk outside, right? 10 minutes of breathing exercises, I think is accomplishable by most people if you can block out that 10 minutes. So it's something that you can weave in, and I think it's important in so many ways, both for the sleep part of it and this cortisol piece. So that gets me to my third leg, which is exercise. And it's a favorite of mine because I am an avid exerciser. And in relationship to immunity, there are good documented studies where moderate to vigorous, intense exercise can help both your immune response, both the innate and adaptive immune response. And interestingly, that study that you really liked when you sleep deprived someone, you gave them a vaccine and they had less of a response. The same thing happens with exercise. So when you exercise, you can have a measurably increased antibody response to vaccinations compared when you don't exercise. So it does boost the immune system in the same way as sleep does too.
So that essentially means that the vaccine is much stronger in your body if you're
And that's a vaccine. So say you get a virus, right? So you're gonna mount more of a response to that virus, theoretically. So exercise is important, but it's the right amount of exercise and the right amount of time as well. Because cortisol is something that's produced by exercise, and that's why cortisol is beneficial in some respects. So in small amounts, it makes our bodies adapt and get stronger. But there are occasions where exercise is not helpful in terms of immunity. And it's the people who do sort of that extreme endurance exercise of like more than 90 minutes at a session. So is this kind of chronic stress, prolonged cortisol? We don't exactly know the mechanism, but we're talking about more of like elite athletes training for marathons. Those people seem to have a lowered immune response.
Why is that? Is that just because the cortisol levels are so high for a sustained period of time when you're doing that sort of rigorous exercise for such a prolonged period of time?
I think that's how I think of it. I think there's some evidence. It's not. I think the mechanism hasn't been fully laid out, but it's a prolonged level of stress, right, over 90 minutes. I mean, not rarely do I can't imagine running for 90 minutes, but people do it.
Well, that makes me feel better because now I won't run for 90 minutes.
But I think that the key point in Pearl here is that you want to do moderate, intense exercise under an hour. And if you can do that regularly, that's going to help your sleep. That's going to help your cortisol response as well.
What is regularly? Is that 3, 4, 5 times a week? Can it be twice a week?
Um, Twice a week is better than none, but I 5 days a week is good. I exercise 5 to 6 days a week. Um, and look, if you do it once a week, twice a week, you're not really going to get conditioned. You need to kind of condition yourself and do something, even if it's 20 minutes, 5 days a week. So we're not saying an hour, 5 days a week, but some level of moderately intense exercise, at least 3 to 4 times a week.
When you're saying moderately intense, I mean, there's like strength training, and then so moderately intense is, getting your heart rate up. Is that cardio, or you're just saying something that's difficult for you? Because you could
I
do
think
moderate yoga, but that's not.
Right. What I would do more of like a power yoga or flow vinyasa yoga, that probably would be more under that category of moderate intense. And I think it's not just one, when I think about exercise, I don't think about one type, right? It should be a lot of different types that, incorporate strength, incorporate mobility, stretching, balance, and cardiovascular. So to have it in the mix is for your best interests, like not just for immunity, but for other reasons, right? For bone health, for example. So mixing it up, I think, is a good prescription.
I agree. I agree. It's all, I mean, it's all kind of common sense, but as we know, common sense is not common practice. So, I
Right.
mean, I feel like none of this is like revolutionary. Like we all kind of know it in the back of our heads. I think the evidence that you're providing is, you know, quite startling and
Yeah.
shocking, quite frankly. And then you have your fourth pillar, which is,
Right. Which is diet, which is eating. Eating well. And regarding immunity, we know that nutritional deficiencies disrupt the immune system and decrease resistance to infection. I think there's really a wealth of information supporting that, and I think it'd be hard to find a counter argument there.
mhm.
And I mean, as a broad stroke, I would say a whole foods based diet emphasizing plants is a generally good idea. Of course, this is all individualized. I have patients who feel best when they're vegetarian. I have people who feel the worst when they're vegan. I have people who are sensitive to certain plants and they can't tolerate, for example, nightshades, which are, potatoes, eggplant, and peppers, white potato. Those for certain people, those are very inflammatory and they cause a lot of joint pain. So there are individual prescriptions for people based on a lot of things, but I think as a broad recommendation, whole foods, non-processed, plant-based diet is a good idea. And so there's the nutritional deficiency part, which there's a lot of data for. But the other thing to think about is the microbiome, which is this 100 trillion bacteria, as vast as the Milky Way, that lives in our gut, and how diet impacts all that, all the bacterial colonies within us. So this microbiome really has lived with us for millions of years, and it's really intertwined in our physiology. And if you think about it, with 100 trillion bacteria, we're probably more microbial than we are in human in terms of DNA. And
Wow.
it sets up this really complex landscape where the microbiome is really tied into our immune system and function. And just to give you an idea of how far reaching microbial life in your gut is and who's growing there and how important it might be, is that who grows there might actually affect your mood. So in the field of psychiatry, there's all this data now that suggests that certain types of bacteria growing there may affect how depressed we are and how anxious we are. I mean, what's the connection there, right? It seems like so,
Really? Wow.
yeah, it seems so disconnected, but it of course it is all connected there. And
Wow.
even there's certain types of cancer immunotherapy treatments that can work better depending on what type of bacteria is in your gut. So
That's crazy. Wow, that's
so
amazing.
Yeah, what we're learning now is full speed ahead compared to what we've known in the past few decades. We're learning so much about this different. I think of it as an organ in itself, this different organ in our body that we've just come to know. And this microbiome communicates with immune cells and uses the compounds that are found in the gut, which some of them called short chain fatty acids, which have a very direct impact on inflammation, effect on T cells. And we know that the diet is really a direct driver of the microbiome, and that they can use these compounds in foods to activate the immune system. And so that's why diet is that fourth pillar here.
Well, there's some foods though that can also do damage as well, right? I don't like sugar or
Sure, sure. I mean, and I think the key point in Pearl here is that you really want to eat a lot of plants. You want to eat vegetables, fruits, whole grains, legumes. Basically, you want fiber to feed that microbiome. You also want to stay away from artificial sweeteners that adversely affect the microbiome, and include lots of fermented foods like kimchi and sauerkraut. And what you mentioned about sugar is obviously stay away from the processed garbage. So, lots of reasons to eat well, and as obesity is one of the big risks of having COVID and having a severe outcome from it. It also plays into a role of making those changes not just for your immune system, but if you're obese, it's another reason for you to, if you're really worried about the pandemic, about this virus, you may want to start cutting your weight, and exercise and eating well are the obvious avenues to get there.
right. So we've covered these four pillars, which are so essential, and that's what I love about functional medicine, right? It's not just kind of looking at the flu or looking at COVID and saying, here's some antibiotics or whatever,
Yeah.
and and you'll be fine type of thing, which seems to be the norm these days. And then we're all sent on our way. But kind of looking at this whole life system on how we can really strengthen our bodies in general, and not only for flu and COVID, but of course, as you mentioned, cancer and other autoimmune illnesses and such. So what are some of the things that you think that we should be taking now that can help boost our immune system, aside from having a whole food diet that's largely plant-based?
Sure. Well, so I mean, there's some people. I have patients who love taking supplements. They're like, well, tell me what I should take. And I have some patients that actually hate taking anything at all. And so what I want to say about it, before I go into the four supplements, is that you want to, during COVID-19, you want to risk stratify. So if you're someone who's over 65, obese, diabetic, heart disease, immunocompromised in some way, or even have some things like blood type A. American College of Physicians now, as part of their guideline, lists blood type A as a potential risk factor, and blood type O as a protective blood type in the pandemic.
So is that true? I was just talking about this yesterday. So that is not a myth. That's actually something.
It's been floating around for some time, but it actually has, and there's studies that we're not completely sure, but that it actually made the American College of Physicians guidelines as a risk factor. So I think there's more data to suggest that is something that is quite a possibility. So if you have some of these things, one or three of these things, might you then want to take a few of the supplements as well? So those are things you have to kind of think about for people who really don't like taking things. And the first one, I think, that has the strongest level of evidence, especially with COVID-19, is vitamin D. So vitamin D is actually less of a vitamin and more of a hormone in terms of how its effects in the body. So it can actually indirectly or directly affect about 5% of the human genome. And if
Wow.
Right. So it's quite a powerful hormone.
But
And the
and yet
people
80% of us don't have enough of it.
Right. I think it's about half of
Yes.
Americans are vitamin D deficient is the general estimate. And there's deficient, there's insufficient, there's sufficient, there's optimal. I mean, we can get into that. But we can make it simple for the purposes of this discussion is just deficiency or not. And the people who are at risk of deficiency are people who have like no exposure to the sun. I have had patients who would wake up at the crack of dawn, get on a train, go to work, leave when it's dark, come home, right? So they had no sun exposure. But aside from those people, the elderly will make less vitamin D. People who are or are obese, darker skinned people, people living at certain latitudes, and of course there are also genetic reasons for why some people, even if they're exposed to sun, don't make vitamin D in the appropriate amount. And vitamin D is actually what I call an immune modulator. And what that means is that it has activity that can either boost, activate, or restore normal immune function. And its importance lies outside of the immune system as well. I mean, it's important for bones, cancer, cardiovascular disease, mood disorders. And there's a statistic where people who have a certain level of vitamin D have a general lower all-cause mortality. That means death from all causes than other people. But immunity is what we're going to focus on, and specifically the data with COVID is important because early on in the spring, vitamin D actually became something of interest because there were a bunch of studies in other countries looking at how people with lower levels of vitamin D seem to be much more susceptible to COVID. What we do know about pre-COVID, just about vitamin D in general, is that if you are deficient, you are potentially more susceptible to getting an upper respiratory infection. And there are other studies that suggest that supplementing with D seems to have a protective effect in terms of respiratory infections.
Oh, wow.
And what you said earlier that a lot of Americans and half of Americans are D deficient, with a much greater proportion of those being African American and Hispanic. And so there's two things about vitamin D. It can actually potentially decrease your risk of infection and also decrease the risk of severity. So there was a study that came out last month in the University of Chicago where they looked at over 400 patients. And those that were deficient in vitamin D were twice as likely to have positive COVID tests compared with those having sufficient levels of vitamin D.
Wow, that's
And
high.
yeah, and if you think about the larger majority of Americans getting COVID infection, African Americans and Hispanic populations are more heavily hit with higher mortality rates. And of course, there are many variables as to why, but could vitamin D deficiency be one contributor? We need a lot more studies to answer that question. But that leads us to the question of risk of severity. So does vitamin D or having enough vitamin D, if you get COVID, does that help with how severe the condition is for you? So,
Can I ask a question? So there's
yeah.
also vitamin D. What's the difference between vitamin D and vitamin D3?
Well, D3 is the active, uh, D3 is the form that you actually want to take. So there's D2, which is more of the inactive form, and there's the D3, which is more active.
Okay.
So,
So if
so
you want to take supplement, the vitamin D supplement, you want to take D3.
yeah, I mean, almost everything out there is D3.
Okay.
So we can when I say vitamin D, I inherently mean vitamin D3.
Okay. Wow. That's so crazy. I didn't realize. I don't think, it's been floating around that people should take more vitamin D just in general. And I was prescribed vitamin D by my doctor several years ago. And so I didn't realize, though, that it was directly related to immunity and fighting COVID. Um, but I hear,
Right.
yeah.
Right. And well, probably because your doctors didn't have enough time to tell you
Yeah.
all the data behind it. But when you hear it, because I have a lot of people who you're going to go on D, you're deficient. And then I see them, 6 to 12 months later, and they're off D. And then their levels of D are low again. And what I find is helpful is to really sit down and talk about what does it mean to have insufficient D and what could that lead to? And that often keeps people on track. Like if you're educated and you know why you're taking vitamin D, you're going to stick with it. It makes sense.
Right.
Back to the risk of severity, and well, also the things about all the stuff that's been floating around for a while. Remember, this is all new to us, right? And the data has always been evolving. So the two studies I'm citing are studies that are just weeks ago that have just come out. So for severity, what we saw from other countries earlier on in the year, we saw a correlation between severe cases of COVID-19 and higher rates of death in those with low levels of vitamin D. And just a few weeks ago, there was a study that came out looking at 235 hospitalized patients in the United States. And those with sufficient levels of vitamin D actually had a decreased risk of severe outcome. What is severe outcome? It means that their oxygen levels were not decreasing, they didn't lose consciousness, and they didn't die. So sufficient levels were associated with this decreased risk of severe outcome. And they also found that, especially with patients older than 40, that sufficient levels of vitamin D were associated with an over 50% less likely risk of dying from the infection. So this is new data, and it's extremely compelling. And so I think the key point in Pearl here is to consider supplementation, especially if you're an at-risk group that we spoke about, but know that it also can be toxic at high doses. So it's one of these, there's a few vitamins that can be toxic if you take too much of it, vitamin A and D being one of them. Vitamin D can lead to something called milk alkali syndrome. But the best way to know is if you get a blood test to know what your optimal dose is. Because I have also people who, assume that the 2,000 units that they're taking is enough, but they need more than the next person who may be able to get their levels up with 1,000 units. So the best way to know is to really get tested.
That's awesome. And so you also talked about zinc, which I used to take for sore throats. When I would feel like a little tickle in my throat, I would take zinc.
Yeah, and I think that's a good idea. There's definitely studies to show that it decreases the duration of the common cold. But zinc is found in, just so people know, it's found in animal meats, shellfish, legumes, and if you're deficient in zinc, it is known to be associated with immune dysfunction and an increased susceptibility to infection. And it's important for both of those arms of the immune system, by the way. And it's important also in preserving the natural tissue barriers in the lung, and possibly preventing the entry of viruses and other pathogens. So that idea of taking like a zinc lozenge at the sign of a cold is a very common thing. And there are a fair amount of studies that show that it actually reduces that duration and it makes you recover faster. I think the studies really look at zinc gluconate and zinc acetate as the best forms of zinc for reducing the common cold, and really at a specific amount, right? So they found that 80 to 90 milligrams in a given day were helpful, but under 75 milligrams really didn't have as much of an effect.
So what's the difference between the gluconate and the acetate?
It's just how zinc is bound. It's the mineral that's bound. It has to be bound to something. So there's zinc picolinate, there's zinc citrate, but it's in the particular studies with the common cold, at least, it's gluconate and acetate forms that you'll find a lot in the lozenges that have the best effect there. There's decent studies that show, these upper respiratory infections and zinc having a beneficial effect. But as far as COVID, there's really not a lot of data. The only thing we really have that it seems that zinc inhibits coronavirus in a cell culture, so in a petri dish. But we don't really have any clinical studies that support COVID specifically. But I think that, the key point here is that we're going into the season where we're going to be challenged with a lot of viruses. And you don't want to be confused, right? Between, that headache that you get, or that little sore throat or fever. Is it a, just a regular rhinovirus, or is it something more, like, SARS-CoV-2? So I think zinc supplementation may be helpful if you're deficient, and possibly at the start of the upper respiratory infection, that might be some time that you start to take zinc.
And you find out if you're deficient by taking a blood test.
Yes. Yes. And look, if you're someone who is eating a very restricted diet for whatever reason, and you're not getting, the sources of zinc in foods, you may be someone who will think about some zinc deficiency, and or be at risk of it, and potentially take it as a prophylactic, supplement.
And then you also talk about elderberries,
Yes.
which
So
I actually started taking right in March when I had first heard about COVID and the pandemic, and there was a bit of controversy around elderberries, I believe, in the beginning.
yes, yes. So the controversy is not, there's not strong evidence, for it, but the recommendations now really are about taking it as a preventative, and then stopping it once you get any signs of an infection. And it's interesting, because it's really opposite of how I usually take elderberry. Before COVID, elderberry is something that I told people to start taking at the very first sign of infection. And I mean, it's been used extensively as an herbal remedy for infections for centuries. Right? It's really actually very easy to grow in the North American continent. When you came to visit me, I had this big elderberry tree that was just, shot up in, 4 feet in a matter of weeks. It's also something that's naturally high in vitamin C, trace minerals, B6, folic acid, and flavonoids. It's the dark purple color of the berries. And all that particular dark color, actually, something called anthocyanins, is actually known to be anti-inflammatory.
And it tastes
And
really good, most importantly.
it does taste good. I mean, I've never actually had it without. When I've made it to make a syrup, I've put sugar in it, so to make it into a syrup. So I've never had it straight necessarily. But it does have, it's been shown to have antiviral and immune modulating activity, especially in the upper respiratory tract. And it seems to inhibit the activity of influenza virus, and seems to be able to bind and prevent the H1N1 infection, at least in vitro. And there was a small study in Scandinavia showing that it shortened the course of patients infected with the influenza virus by 4 days when they were supplementing with elderberry. But it's found to activate certain inflammatory cytokines. So remember, we talked about how inflammation is good. And the controversy lies here, because what they did was they gave healthy people some elderberry, and then they measured cytokines. And it seemed to increase this one specific inflammatory cytokine that was associated with, well, there are many cytokines that are associated with the cytokine storm from COVID, but there's one that seemed to be increased. And just because of that, there was the whole controversy, came up from, well, you shouldn't be on elderberry, and, especially if you're sick, you should stop it. Now, this one study does not provide very strong evidence. And like I said, the anthocyanins that are in the elderberry are known to be anti-inflammatory, decreasing some of the effects of other types of cytokines. But I think the prudent thing to say would be that, and the key point is to consider taking elderberry as a preventative, but stop it if you have any signs of infection. So I think that answers the controversy.
Yeah.
Pretty weak data.
So you can take take elderberry as a syrup, or can you take it as a capsule, or is it mainly as a syrup?
I mean, they are in capsules. They are also in certain immune formulas, part of immune formulas. But the easy way to do it is in a syrup. There's a very common product you can find at a regular drugstore that you can give that's, geared towards kids. They come in gummies for kids, for example. So I like to get it from my farmer's market or make it myself when I've had the time to.
Yeah, you can just go to your backyard. So.
Well, remember I made elderflower this time. I didn't.
That's true.
Birds took all my berries.
And then lastly,
mushrooms, medicinal mushroom.
Mushrooms, yes. The magic mushroom.
Yes.
Or maybe not the magic mushrooms.
Not the magic ones. Those are for other purposes. But when I say medicinal mushrooms, right, so I don't really talk about culinary mushrooms, although there are some culinary mushrooms that are maybe very helpful in the immune system. But you should know that mushrooms have been very, very well studied for decades in Asia. And so we actually have a wealth of information on the immunomodulating effects of various mushrooms. And specifically in Japan, there are mushrooms that are specifically used in oncology wards for the treatment of various cancers. So this is quote real medicine in Japan. So and a lot of our data stems from there. So there's a lot of well-documented science to support the beneficial effects on the immune system, right? Especially the upregulation of those natural killer cells. But how also those natural killers function, right? So you can have a lot of natural killer cells, but if they're functioning well, like they're healthy soldiers, that's also another part of the story. And the mushrooms also are important in the complex interplay between the immune system and sort of the pro and anti-inflammatory cytokines as well. And there's some mushrooms like Agaricus blazei that are known to have specific anti-inflammatory activity. There's no specific data for COVID-19, but I've been using mushrooms for over 15 years in patients for a variety of different circumstances. I've had people who, some of the easier cases, I don't get easy cases, but sometimes I have someone who comes in and says, I'm getting sick all the time. I've had a handful of cases where I just put them on medicinal mushrooms and they don't get sick anymore. So it's something that I've used myself, in the start of the cold and flu season. Once kids go back to school, I start my mushrooms and I taper off in the late spring.
So how are you taking these mushrooms? Are you cooking it in your food, or you're is it a powder or?
No. Yeah, they're not edible, like you wouldn't want to eat them. So they're usually in a powder, but they come conveniently in a capsule. And there was also controversy here in the same way that elderberry had that controversy, where some of the effects that were seen in the isolates of the mushrooms. So you have, with the mushroom, you have the fruiting body of the mushroom, the stuff that you see above the ground, and then you see the mycelium, which is, you can think of it as the roots of the mushroom. That's where most mushrooms are made, from either the mycelium or the actual fruiting body. But there were certain isolates, which were called polysaccharides, specifically 1,3-beta-glucan, just polysaccharides. And they seem to increase that pro-inflammatory cytokine, that IL-1B, that was associated with the cytokine storm in COVID. So that again, it's an incomplete picture, but based on the data that we have, my recommendation is really to avoid supplements that just have the isolated polysaccharide and stick with more of the broad mushroom formulas. They can contain things like Agaricus blazei, turkey tail, reishi, cordyceps, maitake, and the key point is not taking the isolated polysaccharides.
So where do you even order these medicinal mushrooms?
So the brands that have this broad mushroom or mycelial extract formulas are Real Mushrooms. That's one brand. Paul Stamets's Host Defense. Mushroom Science makes something called Immune Builder. These are all really good formulas from good companies that I do trust. But I just want to say that I have some people that are taking formulas that contain 1,3-beta-glucans for other reasons that are helpful for them. And the thing would be just if you do take them and you do get sick, just stop.
Right.
But no need to stop your regular mushroom formulas that I mentioned.
Wow, that's so awesome. Wow, this is a lot of information. My goodness, this is just, and it's so important. And I think that this is all on top of mind for so many people right now. I think there's a lot of anxiety out there about, just making sure that they keep their families protected. And I think these are really great steps that people can do, that they're easy, that it doesn't have to, these are all doable, even though maybe it
Right.
doesn't
They're
feel.
all doable. They're the easy ones that I just mentioned, and they're the harder ones that were part of the table that are always hard for people. But it's a good time to start. I mean, the best time is right now.